here. Thank you also for what you do when you're not here in your professional lives and the massive difference you make to families up and down our country. It's a special honour to have had Jeremy warming up for me. That's very good of him. And I would have happily warmed up for either Theresa May or Jeremy Hunt had they chosen to accept your offer to be here. Election or not, it always strikes me that if you want to kind of lead the people, you ought to demonstrate that you rather like them and you don't mind spending time in their company, even if they will say something difficult that you don't want to hear. That is democracy. So it's a shame that I'm warming up for no other party leader. But I'll say this. So is there a threat to democracy? Does it feel like conversation and debate in this country has been closed in some way? The Prime Minister and her senior colleagues hiding away from the public, not being allowed to be interviewed by journalists who haven't cleared their questions beforehand, not coming to arenas like this to listen as well as to talk. Yes, it does feel like democracy is somehow under pressure at the moment. It also worries me, you hear these phrases at the moment that, Theresa May is heading on the 8th of June for the kind of colossal landslide that Margaret Thatcher enjoyed twice in the 1980s. And people say that as though it's some kind of political consideration. To me, it's not. To me, it's a very, very bad memory. See, I grew up in the 1980s in Preston, not too many miles north of here. And I grew up at a time where I saw maybe half of my mates' parents, including mine from time to time, out of work. I see what happens to a community or a set of communities when you have a government, dare I say a Conservative government, with such a colossal majority, they just take people for granted. And I worry hugely for not just the communities I grew up in, the community I represent now in Cumbria, but the health service, for education, for social care, for those fundamental pillars of a decent society. What will it be like for us if we are left with a majority government so huge, so impregnable, they can afford to take us all for granted? That terrifies me, but it also motivates me, because I am not prepared to give in to another generation wasted and affected like the one I grew up in. It's time we stood together, it's time we fought for our health service, we fought for our social care, and we value those things that make Britain truly great. So, my experiences, I guess, growing up and in the community that I am proud to live amongst and serve today, make me determined to build the kind of country that our children can grow up in, where we are basically decent to one another, where part of that decency is having strong public services, fully funded, free at the point of use, that we can be actually proud of, as well as knowing we can rely on them, as was once said, from cradle to grave. Now, to me, NHS and care are hugely significant politically, but they're hugely significant to me personally. From the moment that my dear late mum was diagnosed with ovarian cancer, through her treatment, through her care, through the immense dignity of her passing away on the ward in Preston Hospital, just yards away from that ward where she gave birth to me 3 decades earlier, to my grandfather's experience of going through social care, his journey through Alzheimer's, some of the shoddy care, let's be honest, that he received at some point because of the lack of investment in that system, to the brilliant care, the wonderful people working for a pittance to provide that support for him, and seeing his life proceed with dignity. That pride I felt in my community, stepping up to support my dear late grandfather. And as a dad, if you've got 4 kids, you spend an amount of time in A&E from time to time, don't you? I was at the out-of-hours service yesterday with one of my children, and it is a reminder of what you do every single day. The National Health Service and social care are spoken about as political issues. They are used as political footballs. Of course, health and care is riddled, and rightly, with politics, but in the end, it's about the personal. And that is what motivates me. That is why I am here. And I'll tell you, as a son, as a grandson, as a father, my experience of the health service, if you like, as a punter, is utterly exemplary. Utterly, without compare. And I don't say, as a punter, that I, generally speaking, have much of a clue, much of a sense of health and care being in crisis. But as a Member of Parliament who listens to people who work in health and care, whether it be the district nurse who came to see me on Friday telling me that her mileage rate has been reduced to 20p a mile and she's basically being penalised for working in a rural area, whether it is talking to our local hospital, finding out there's not a single doctor on overnight, whether it's talking to the young woman last week in my part of the world who has got anorexia and yet is not able to receive any access to services yet because she's not yet ill enough, whether it is any of those experiences, I tell you that I am absolutely aware that health and social care faces a crisis like no other. The word crisis is bandied around politically far too often, and in reality, in health and social care, it is there. And that is why my motivation in building a platform for this general election is one that puts health and care right at the centre. Now, let me be honest. When I woke up that morning after Bank Holiday Monday a few weeks ago, I did not expect Theresa May to call an election that day. My reaction was slightly more positive than Brenda from Bristol's, but nevertheless, now I've been calling for an early general election since last July. And the bottom line is, if you call for an early general election, you should prepare for one. So we did. We had candidates in place, manifesto written, and a central part of it was our vision for creating a new deal with the people of this country, with every family in this country, for a health and social care service that would be restored in terms of its funding provision to the levels that we would want it to be. And I was absolutely clear that there is no way of providing additional money for health and social care if you're not honest and clear with the people of this country where you are getting it from. Now, 80% of people polled tell us they'd be prepared to pay more in taxation for health and care so long as it was ring-fenced for health and care. And I'm taking a big risk on assuming those 80% of people meant it. Because I take the view that there is no way of dealing with the serious problems we face in health and care without additional funding. Yes, there's always efficiencies that could be done. Yes, there are always changes in government legislation that may help, though often they hinder. Essentially, what we have found over the last several years is a real terms drop in health and care funding, which put us right down the European League table. Do we have the best system of health care in the world? Yes. Do we have the best staff and professionals in the world? For certain. Are we the best funded in the world? Stop kidding yourselves. No, we're not. We are behind Portugal, Spain and Greece and other countries that are deemed to be much poorer than the United Kingdom when it comes to the proportion of our wealth that we spend on health and care, and it is time to put an end to that and invest in health and care properly. That is why we will boldly say to the British people, if you want the best health and social care in the world, then it will cost you, but you will get it. It will cost you 1 penny on income tax for an additional £6 billion a year, 30 billion over a parliament, added on to the Simon Stevens 8 billion, and the additional 10 billion we will put back into restoring nursing and midwifery bursaries. That is a £48 billion package over a coming parliament, far more than any other party is offering, and unlike any other offers from any other party, actually costed and believable. I take the view that the British people will vote for a package that they can believe in and they can trust. And politicians have a habit of putting your taxes up, but this one's going to do something different. He will tell you so first, without doing so afterwards and secretively. Look, I'll tell you what, this is not about... So, it's not about numbers, it's about people. It's about the people who work in our National Health Service and social care, but it's also about the people and the families who make use of health and care every single day. It's not about numbers, but here are a few numbers. 8% of nurses and midwives every year leaving the profession before, and often long before, retirement. 14,000 EU nurses set to leave the profession, leave the United Kingdom as a consequence of Brexit. A 23% reduction in the number of applications for nursing and midwifery since the abolition of bursaries was first announced. 24,000 nursing vacancies across this country, a 14% real terms drop in earnings for members of this Royal College. Those numbers are all about people, and they are all connected. If you undervalue nurses and midwives and professionals of any kind whatsoever, don't be surprised if they leave the profession. Don't be surprised if they find themselves, as we discovered only a few weeks ago, members of the nursing profession accessing food banks, and you find a Prime Minister who thinks that's somehow not an issue. It feeds into a narrative of this Conservative government treating nurses like dirt, and I will not have it. It seems... So, the time to invest in health and care has come, and it has come in, and it was not a moment too soon. It's important to invest in nurses, and that is why, just to clarify, we will reintroduce the nursing and midwifery bursaries, and we will ensure, as we've announced today, a public sector pay rise across the public sector, including health and social care, but also schools, local government, central government, our armed forces, because over the last decade, since the crash, we have seen a huge blow, like you say, a 14% decrease in real terms earnings of members of the Royal College of Nursing. And it is time we gave Britain's public service servants the pay rise they deserve. And look, I think what threatens the National Health Service probably more than anything else when it comes to funding and the direction of travel for our country is the government's choice of the most extreme version of Brexit. Now, I observe that that is a version of Brexit taking us out of the single market, which brings Theresa May and the Socialist Workers' Party onto the same side. Interesting observation. It is a huge economic decision to take Britain out of the single market. Let's just use the Conservatives' own figures. A £59 billion black hole in our public spending as a consequence of choosing to leave the single market. Now, maybe you think we should be in the single market, maybe you think we shouldn't, but it wasn't on the ballot paper last June. It is a political choice. It is not an enacting of the will of the people. It is at best an interpreting, dare I say, even a twisting of the will of the people. To choose to take us out of the single market is to make the single biggest choice ever to remove available funds for our public services and health and social care in particular. Now, I am not here, particularly given he went before me, to have a go at Jeremy Corbyn. I quite like the guy. During the Blair years, he was always in our lobby. He was never in Labour's. And I like the guy. But I'm bound to say that Jeremy Corbyn, the one then UKIP MP, and Theresa May all voted for that hardest version of Brexit. And that means any party that makes a kind of public sector spending offer, having voted to take a minimum of £59 billion out of our economy because of a choice of taking us out of the single market and the hardest, worst, most extreme version of Brexit, is not able to deliver the thing they offer. That is why it's vital. And if you believe that our direction as a country is not settled yet, that there can be a better ending than the one that Theresa May is currently offering us, I am offering you a lifeboat back into the single market, back into a situation where we as a country can afford the public services that we desperately need. Because I believe a brighter future is absolutely possible. And an extreme divisive version of Brexit, I would say, is just one part of the problem. You see, there are many people, many progressive-minded people, I would say, probably the majority of people I grew up with in Preston voted to leave the EU, and I completely respect that. But I also take the view that there was a worldview that the most extreme version of Brexit has been fitted into. And it's a betrayal of those people. 95% of the people who voted to leave the European Union did not sign up to the Nigel Farage extreme Theresa May version of leaving the European Union. Because I think it is an absolute appalling assault on our decency as a country that other things have been added to that worldview. And that includes the turning our backs on refugees, something that shames me and shames our country. That includes a denial that climate change is a reality and the withdrawal of funding and support to do everything we can for our children's sake to tackle it for the future. And it includes the shrinking of our state, the shrinking of our public services, of health, of social care, of education, and so many other things besides. And there is a temptation, it must be a massive temptation for many of us here and around the country to look at that mean and bleak direction that Theresa May is apparently taking this country on and getting a landslide perhaps in the process, and to think that the only thing we can do is to weep into our beer, to weep into our coffee and just hope for better times in future. I want to offer you the possibility that you can stop that weeping into your beer or your coffee, that maybe, just maybe, the Britain that we love is not lost yet, that there is hope of a better Britain, a Britain that invests in health and social care, a Britain that believes that climate change is real and there is a joyful national endeavour to get involved with, to tackle it and to defeat it for our children's sake, a Britain that stops turning its back on refugees or indeed on the rest of the world, but embraces it, is internationalist, outward looking, to be the leader that we have always been as a country. And the thing that we are most proud of, the thing that brought tears to all of our eyes when we watched the 2012 Olympic ceremony those years ago, was the fundamental, central part of our British culture and national health and social care service that we are utterly proud of. Do not give up on that future. I will not give up on that future. There is hope. There is a better way forward. Please vote for it. Thank you. Thanks very much. Yeah, it's been my great pleasure. Yeah, thanks. What do you want me to just say it? Yeah, of course. No, that's fine.
OK, colleagues, I'm sure we have some questions for Mr Farron lined up. He's going to take them from the podium. We'll take them two at a time. I'm going to ask you your first question, Mr Farron, and it's on behalf of Congress. You'll be aware that we took a momentous decision after our pay poll and our views on the cap of public sector pay. What are your reflections on how momentous that is for a trade union and a college such as ours to take? What does that feel like to you?
Well, I think, first of all, if you spend time with professionals in health and care, you understand how utterly dedicated they are to what they do. And I said earlier on that as a punter, I don't experience or not so obviously, the huge threat and pressure that you are under and your members are under, but that I know in reality below the surface you realise what a massive decision it is to stand up and to do that. And it is something that I think you undoubtedly do not take lightly, and it's something that you do because you have care and concern for your patients. This is about you as professionals and your families, but it's actually about families across the country. It's about not being prepared to see an erosion of income, an erosion in living standards that means that A, it's appalling for you morally and financially, but B, it turns off people joining the profession. We want people to look at the caring professions, nursing, midwifery, and all the other professions within the National Health Service and say, that's the career for me. I've just been with a bunch of young folks at Southport College, training to be nurses and midwives, and indeed also, preschool teachers as well. And the one thing I want for them is to be able to look forward to a career that is going to keep them in a decent income, give them a decent career procession ahead, and give them prospects. But I want it for them, but I want it for the people they're going to care for. And that's why you made the choice that you did.
Thank you. I'm now going to pass to Matthew and Ed to ask their questions.
Matthew Sidebottom, Sheffield branch.
Hi, Matthew.
So I'm expected to work in a demanding job until I'm 68. Do you think this is safe for my patients? Do you think this is safe for me? If not, what are you going to do about it? Bear in mind, when you're answering this question, that your party was in government when said legislation was passed that added another 8 years to my pensionable age.
Yeah. I mean,
Mr Farron, are you taking Ed, or do you want him to take them one at a time?
Well, it depends how many there are, really. I can give us another one, and I'll do a couple at once.
All right, OK.
Ed?
Good afternoon, Mr Farron. Ed Freshwater, the voting member for the Mental Health Forum. Our question in two parts is how will you, as Prime Minister, or in opposition, protect and promote the needs of people experiencing mental illness? And will you appoint a Minister for Mental Health?
Okay, great. Well, so first things first. I think the issue about pensions, I think we're dealing, especially at the moment, with the women who are 50s, 60s, who were told of the change in their circumstances, not once but twice, and both times too late. I think we recognise, as we live longer lives, generally speaking, that the pension age was always going to rise, and important that it was made equal. The issue is two things. Are we given enough notice? And are we going to get a decent pension when we do retire? And secondly, the professions that it is possible to work to 68 in, well, it'll be different to different professions. You look at policing and some of those other professions where that is not required, people are not required to work to that level. And the reason why is in no small part down to the work we did in government to persuade the Tories to lower that and to increase the number of people who are in those categories. But you make a very good point for the profession you're involved in. To be forced to work to that level may end up being detrimental to you, may end up being detrimental to patients. And in doing that, in making choices as to which professions are deemed to be retirable sooner, that's going to be the fundamental issue. We've got to be thinking about your well-being, but the well-being of carers. And I'm not convinced that has always been the case. Your point about the issue about mental health investment and mental health appointments of a minister, for certain we'll appoint a mental health minister. I mentioned briefly earlier on in my remarks a young woman I spoke to Thursday, I think it was, in my area. She's no longer an adolescent, she's an adult now. But she is somebody, as I say, with anorexia, was told she cannot get treatment because she's not sufficiently ill. And there are many things. I've dealt with 92,000 bits of casework since I became an MP 12 years ago, which I believe is a record, but I'm not convinced. But in any event, lots of them stay with me. Lots of them affect me personally. But there's nothing that affects me personally more than mental health issues, specifically those affecting young people and their families when there is no treatment available or they're having to wait for weeks and weeks and weeks for a referral. And what we did, and Norman Lamb, my colleague, did this to great effect when we were in government, was to make sure that you finally get waiting times and we start to achieve progress. But the lack of funding is obvious. And when we say we need to put an extra 48 billion into the NHS over a 5-year period, one of the key planks is in mental health, making sure that people can be seen quickly and sooner. So that young woman I'm just referring to, there is far greater chance of her never becoming ill, seriously ill or worse, if she gets treatment now. And the number of mental health conditions are allowed to get worse because there's only support for extreme intervention and for at the most serious end of cases. And when issues are arising and developing, people are able to get the treatment that they desperately need. And that is utterly heartbreaking for those people, for their families. Is appalling. For the professionals, the frustration of not being able to tackle that kind of a condition when you know that you could do a better job if you did it earlier is utterly appalling. But it's also just foolish from a financial point of view. If you end up waiting for people to get worse, it costs society, it costs those people, it costs the taxpayer more. So it's not just a morally right thing to invest in mental health, it is also practically and financially right too.
Thank you. Can I ask Coral Rees and Jeff Errol to ask their questions, please? We'll try and get through them all. Have you finished on? We'll have us all finished on time.
I'll try and be pithy.
Coral Rees, Children and Young People's Acute Care Forum. How will your party generate the money in the NHS, the money the NHS needs to function and develop the services everyone in this room feels that the public has a right to expect?
So how will we generate the funding in order to make it possible to meet what we've promised? So we've been really, really clear about what we will do. So the £8 billion that Simon Stevens has put into and sought and gained for the National Health Service, we count that as part of £48 billion worth of investment. The £10 billion over Parliament, so £2 billion a year into midwifery and nursing bursaries. But the big chunk is the additional £30 billion, which will be raised from a penny on income tax, specifically ring-fenced for health and social care. And the point of doing doing, that's about £6 billion a year over the lifetime of a Parliament. Our view, by the way, is that we put together a panel which included people like Claire Gerarda and David Nicholson and many others as well. And we asked them to go away, and if it wasn't to flatter them too much, to say, consider yourselves as the collective 2017 version of William Beveridge. Go and write the best possible plan for health and social care for the rest of this century. Do for the 21st century what William Beveridge and Nye Bevan and others did for the latter half of the 20th. And there's no way of doing that without a financial tag attached. So we've talked about our short-term, this Parliament approach, where the money will come from. But as that panel concludes its work in the coming months, because that's one of the things that Theresa May managed to short-circuit for us, but as that panel concludes its work in the coming months, we'll be looking at bigger options going forward, like potentially a much larger ring-fenced health and social care tax. It will mean money coming off other forms of taxation, so it's not a huge burden, but to make sure that people are offered a deal, a contract, because there's a sense that when the National Health Service and the welfare state began in the late 1940s, it began with the British people being offered a deal. This is the decent society you will grow up and live in, you will be cared for with dignity from cradle to grave, and here's the price. And that I am proud. I am proud of the Liberal, William Beveridge's involvement in that, in writing that blueprint that made Britain a better place after the Second World War. I'm immensely proud of it. But the reality is time has moved on, and a new deal is needed now. So that's how we'll pay for it in the next 5 years. But our vision is to say to the British people, Beveridge's vision was marvellous. We need to replicate it and renew it and offer this country for the 21st century what Beveridge did for the latter half of the 20th.
Thank you. Jeff?
Jeff Earl, Lothian branch. Hi, Tim.
Hi,
right at the beginning, you said you're happy with awkward questions, so here we go.
Go for it.
The last time that your party addressed Congress, you promised much. For example, no rise in tuition fees. However, when part of the coalition government, you went back on your promises and you introduced a disastrous reform of NHS England, which was in neither manifesto. Why should we believe anything you say to us now?
Fine question. So, you use you as plural and not singular, I noticed. Because, as you know, I voted against the rise in tuition fees. You also know that I voted for, I didn't vote in the end for the Health and Social Care Act, and I voted for quite a significant number of the key amendments that would have transformed it. And let's just mention, I suppose, fees first and foremost. People often think that's the thing that did for the Liberal Democrats, and it may or may not be true, who knows. But I'll tell you what, I never thought that issue was about fees. It was about trust. And the problem is that if you are living in a society, and we are, where people assume politicians are scumbags who don't tell the truth, don't confirm the suspicion. Don't confirm the suspicion. And so my view is this. I mean, I could make, and we haven't got the time, but I can make a reasonably lengthy justification for the system that fees entail. The change system, you don't pay many more under it now unless you are earning more than 70 grand a year. But the point is, in politics and in life, it takes you more than 5 seconds to excuse yourself, explain yourself, you've lost. And the bottom line is that you must not just do the right thing in politics, you must be seen to do the right thing. You must make promises, and when you make them, you should flaming well keep them. And I take the view that that matters specifically when it comes to things I've just spoken to you about. I do not think that the British people would believe any party that promises a mass multi-billion-pound injection of resources into the health service if they didn't tell them where it was going to come from. And in particular, if they didn't tell them the truth is that it will cost you. It will cost every family in this country a penny on income tax that will go towards our health and social care system. And that's critical. It's one of the reasons I'm so keen that we get this message across, because I want the British people to feel this is not a party saying a cost-free spewing out of populist ideas. This is a party that's really realising that it's time to level with the British people. You want the best health and social care that this country could possibly have. It will cost us. And one party and one party alone is being honest with you. It will cost you and offering you the opportunity to buy into, to get involved in the best contract this country has ever seen.
So in summary, Mr Farron, just so that I can bring it back, good robust in summary, what you're saying is if the Liberals end up in another coalition, you will not go back on any of your principles within your manifesto.
So the easy thing to say, so I think first of all, if you're in coalition, sometimes you compromise. I think the tuition fee issue was significant because it was a specific pledge, and you should keep those. Now, the reality is, we've been very, very clear at the beginning of this election period, we'll go into coalition with nobody. I think this election is so utterly significant that people need to know when they vote Liberal Democrat, they are voting for the one party that gives the British people the chance to have the final say on the referendum deal, on the Brexit deal. And that means allowing you the choice to reject a deal if you think it is bad news for health and social care. It also means offering you the one chance, the one lifeboat in existence, to vote to remain if that deal is not good enough for you. And if you think, as the 73% of young people in this country think, that leaving on that extreme version of Brexit that Theresa May has offered us is an appalling direction that will damage every part of our social care and health system, if you believe that, we are literally, in the words of Princess Leia, your only hope. Your only hope. Give us your vote this time round and make sure we give you the opportunity to change Britain's future.
Colleagues, I know we had more questions lined up and I would have liked to continue the discussion. We're now at the time, 12:30. I believe you've somewhere else to be, or can you take another couple of questions?
Yeah, I can do 2 more questions. Yeah, go for it.
There we are. Thank you very much. Okay, so can I ask Heather Henry to ask her question, please? And you have said about tuition fees, and I've pressed you on some of that, so I'm going to ask Shelley Pearce to ask her question after.
Okay. Hiya.
Hi, Heather Henry.
Heather.
I'm a member of the Public Health Nursing Forum and Central Manchester branch. You're on record saying that you're in favour of legalisation of cannabis. Can you tell us what evidence this is based on?
Yeah. So, first of all, our party commissioned an independent panel 2 years ago, which reported about 18 months ago, which included a whole range of medical professionals, but also included one serving and one recent UK Chief Constable, to look at how regulation works in other parts of the world and to make, again, an evidence-based conclusion as to what would be the best thing for the country. Now, I'm somebody who doesn't approach this from a libertarian point of view. I am utterly aware of the consequences, the health consequences of drug use, including, and probably the greatest, most damaging form of drug use, and that is alcohol abuse. And being aware of that, the question is, how do you, on the basis of evidence, put forward a kind of rational set of proposals that could make things somewhat better? And the evidence from around the world led us to conclude that the regulation of cannabis was a wise thing to do, because you do 2 or 3 things. First of all, you take the ability to make vast amounts of money out of that trade, out of the hands of the criminal gangs. It's about taking back control from the criminal gangs. You also create a wall between the purchasing of cannabis and the purchasing of far more dangerous strands of cannabis, because you can regulate what would and wouldn't be in the regulated sector, and indeed harder drugs completely. And the evidence suggests that regulating cannabis as we propose does not increase usage of it, does protect people from the more dangerous strains of it, and reduces cannabis as a gateway drug, in the sense that you are buying it from a different place to where you would buy the other substances. This is a considered, thoughtful approach. It's about tackling criminality and trying to minimise the health risks associated.
Last question, thank you.
This question is from Shelley Pearce from South East Region. Can we restart NICE's work to set safe staffing levels for all health settings?
Yeah, I think that's critical. I mean, one thing I'm bound to say, proof that you can do things from opposition. In the Welsh Assembly government, Kirsty Williams, who is now the Education Secretary, but when she was the leader of the Liberal Democrats in opposition, one of the things that she managed to ensure was that very thing. I think Wales is the only place in Europe where you have a law on safe staffing, and I'm proud of that. My concern about setting a target now, before the money's there, is you end up setting a target that will just be met. We just talked about the number of nurses leaving the profession, so undoubtedly that is my goal, to do the same as we have in Wales. But let's be honest with ourselves. First and foremost, we need to pay nurses enough to make sure you recruit and retain them, and you need the investment in health and indeed care more generally that I've just set out that we're going to pay for, to mean that you'll bring those people in, and therefore safe staffing levels will be something we can actually achieve in every hospital in this country and not just Wales.
That concludes the questions. I'm sorry we didn't get to them all. I am pushed for time. Thank you so much for your time.
It's all right. Thanks for yours.
Thank you. Can we have a round of applause for
genuine pleasure. Thanks, guys. Thanks a lot. Thank you.